here. In today's video, I'll be talking about depression, what it is, what are the signs and symptoms of depression, and what we can do about it. So let's get started. We all feel down from time to time, getting a bad grade, or life not going the way we want it to be, or having troubles in a relationship, which makes us feel sad and confused. And so we use the statement so commonly, I am depressed. But it is not true most of the time. It is just sadness at that given moment. And it can be due to our work or due to the weather, as research shows that even rain can affect our mood, which can make us feel sad. But then the circumstances and the environment changes, and so along with it our feelings. The inability to tell others about the pain, as it is not a physical disease like diabetes or arthritis. So the misconception about having depression and feeling depression stands. There are many times we see an individual who is seen happy on the outside, but on the inside might be suffering, might be thinking what is happening to him and why is it happening to him. Depression is a clinical disorder. It will not go away just because we want it to. In fact, depression is one of the leading mental health disorders in the world, with around 13% of the Indian population getting affected and most of us getting undiagnosed for almost 10 years. So the question stands, what is depression? Depression is a common mental health illness which negatively affects the way we think, the way we feel, and the way we behave. It can lead to significant emotional as well as physical problems, which affects the way we function at our home as well as our work. Sadness or low mood throughout the day, which is consistent and pervasive, meaning that it is present for a minimum of 2 weeks, and pervasive meaning that it is present across different life situations. And sadness is significantly interfering in one's life and work. Changes in sleep pattern, either sleeping too much or too little, changes in appetite with weight loss without dieting or unexplainable weight gain. Other signs and symptoms include fatigue, being tired throughout the day, or being low on energy. Loss of interest and pleasure in activities in which one used to find pleasure in. Feelings of hopelessness, helplessness, and worthlessness, usually relating to self, one's environment, and one's future. Last but not the least, recurrent thoughts about death and suicide. Depression is an umbrella term, and it may show different signs and symptoms for each individual. Some of the common types of depression are clinical depression, which is major depressive disorder; dysthymia, which is a long-lasting depression; bipolar depression, which is wherein an individual fluctuates between manic and depressive episodes; postnatal depression, which is depression experienced right after giving birth; seasonal depression, depression which is associated to seasonal variations, as research also shows that we are more prone to developing depression in winters rather than in summers; situational depression, which is depression associated with specific situations which are stressful for the individual, resulting in depression. Now that we know the signs and symptoms of depression, let's see what causes depression. There can be several factors like biochemistry. Changes in certain brain chemicals like dopamine, norepinephrine, or serotonin can contribute to developing depression. Family history and genetics also contribute to developing depression. It is sometimes seen that it runs in the family, especially in immediate relatives and siblings, then one is more prone towards developing depression. As research shows that if one identical twin has depression, the other is more likely to develop depression sometime in their life. Depression is seen as a combination of genes rather than a single gene. The person's personality can also contribute to developing depression, especially if one has low self-esteem or gets easily overwhelmed by stress, negative thoughts, can develop depression, and a person who has a pessimistic outlook towards life. Environment is also seen to play a part in developing depression, especially if one is in a very abusive or in a very poverty range environment, then it develops a depression or is more prone to developing depression. Vitamin deficiency like vitamin B, vitamin B6 and vitamin B12 are also seen to contribute to developing depression. There may or may not be a cause for depression, but it is seen more commonly in women than in men. Many a times it is confused with a more common term with which we all are accustomed to. It is sadness. Both sadness and depression share a lot of similarities. Like both groups cry, both groups have symptoms of withdrawal, but there is one major difference. A person who is sad will be able to tell you what is that person sad about, the specific thing, but a person who is depressed will never be able to pinpoint a specific situation why that person is sad about. That person might say that I'm sad about this or sad about that, but will never be able to tell you the specific thing. That person is depressed. When having visible symptoms of depression, then early treatment for depression is much easier than when the symptoms of depression are not visible, which is usually the case with depressive patients. It can take years before one seeks treatment. Though depression cannot be cured, the signs and symptoms can only be reduced. The goal when treating depression is that the individual is able to live his life and work effectively with the help of medicine and psychotherapy. Psychotherapies like cognitive behavior therapy, CBT, and psychodynamic psychotherapies are seen to be effective. Medications like antidepressants, which are usually selective serotonin reuptake inhibitors, SSRIs, are given. Sometimes anti-anxiety medications and antipsychotic depressants are also prescribed by the psychiatrist. One can cope with depression by doing meditation and yoga. Every day, try to bring in some exercise to your body. This will help you in activating your body and feeling refreshed. Every day, maintain a regular schedule. This will help you in thinking less and try to complete difficult tasks first and then simpler ones so that you feel accomplished, and it will also act as a reward. Try to think more positive thoughts. In any situation, we get a lot of automatic thoughts. They are usually negative thoughts. Try to consciously change those negative thoughts with more positive affirmations. Like, I cannot do this task. This is very difficult. Instead, think, I can do this task. If I take regular breaks and try to complete some task as every day, I'll be able to complete it within the deadline. Be more creative. Draw, paint, dance, sing, whatever is your thing. Try inculcating it in your life. Share your thoughts with your friends and family members who you can trust and who you feel will listen to you and will guide you in a positive manner. Finally, contact a mental health professional if you feel that your feelings and emotions cannot be handled by you and you are in need of assistance and therapy. Don't hesitate and contact one. I hope you benefit from this. Don't forget to like, share, and subscribe. Let's make mental health our priority. See you next time.